Minister Merriman.
Thank you very much, and good afternoon, and thank you again for joining me here today. I'd like to begin by thanking our valuable healthcare workers across this province who continue to do a tremendous work under extremely challenging circumstances to not only treat COVID patients, but all the other Saskatchewan residents that require medical care. I'd also like to pass on my condolences to those that we have lost since my last meeting. On September 16th, our government announced a number of new public health measures to help control the spread of COVID-19 and relieve some pressure being felt across our healthcare system. Since that time, we have continued to experience new highs in COVID-19 cases, hospitalization, and ICU admissions. These numbers are extremely concerning. We know, based on the most up-to-date data, that these trends continue to be driven by those that are unvaccinated. About 80% of our new cases each day are unvaccinated residents. And the overwhelming majority of serious cases, the ones that end up in the hospital and ICU, are unvaccinated. Of the 67 patients in ICU today, 54 are unvaccinated and another 4 are only partially vaccinated. That's 58 out of 67 in our ICU, or about 87% who are not fully vaccinated. The facts are clear. If everyone was vaccinated, we may still have some cases, but it would be a very manageable number of cases and hospitalizations each day. Instead, we have too many unvaccinated people, and that's what's putting pressure on our healthcare system. The solution is simple. If you haven't done so already, get vaccinated. We make vaccines readily available across the province. Overwhelming majority to make them available in pop-up clinics, through pharmacies, and where people live, work, and play. The choice not to get vaccinated is not just affecting you. It's creating unnecessary pressures on our healthcare system. If you are unvaccinated and living in Saskatchewan, go get your shot. It's the right thing to do. And starting Friday, October 1st, life is going to get more difficult for those who choose to remain unvaccinated. Proof of vaccination or proof of negative test will be required by all Government of Saskatchewan ministry, Crown, and agency employees. Proof of vaccination is also being implemented for all employees within the Saskatchewan Health Authority. In order to help protect our critical frontline staff, our patients, and help preserve our healthcare system, employees who do not provide proof of vaccination will be required to provide proof of negative test result from within the previous 72 hours. Should an individual choose not to disclose their vaccination status or choose to remain unvaccinated, the cost of the proof of a negative test result for asymptomatic testing will be their responsibility. Negative tests will be required at least every 7 days and be required for those who are partially vaccinated. A self-administered take-home rapid test will not be accepted as a proof of negative test. In order to free up SHA testing capacity, the SHA will not be providing testing for asymptomatic individuals with few exceptions. Priority will be given to those presenting with symptoms unless identified as a close contact, have a positive rapid test, identified as part of an outbreak situation, or requiring transfers or admissions to long-term care, primary care, social services, or intensive care units. In order to facilitate this policy, regulatory changes under the Public Employees COVID-19 emergency regulations will come into force. Employers outside the public service can voluntarily opt in if they wish to implement a proof of vaccination or negative test policy for their employees. It will be up to each business and organization to determine proof of vaccination. However, the QR code, the wallet card, a printed copy of vaccination records, and screenshot of vaccination records are all acceptable forms of vaccination. So the vast majority of Saskatchewan are fully vaccinated. Not much is going to change. I've loaded up my QR code on my phone, so it's very easy to show somebody. And I also have my wallet card as backup. Businesses requiring proof of vaccination will also require valid ID from anyone 18 years and older to verify your name matches the name on the proof of vaccination. Youth 12 to 17 visiting a business without an adult who do not have photo identification will be allowed to present other forms of government-issued identification. To better support Saskatchewan's mandatory proof of vaccination requirements, businesses or organizations may now choose to download and use the free SaskVax Verifier app. The app is available on Apple and soon to be available on Android. Citizens wishing to use the app can acquire their vaccination certificate with a QR code through My Sask Health Record. And if you can take a screenshot of the QR code or download the SaskVax wallet app to help store their certification of vaccination. Of course, the goal of the new proof of vaccination policy is not to punish those unvaccinated people. The goal is to convince them to get vaccinated, and it's been working. Our rate of first shots has more than doubled since the policy was announced, compared to where it was just before the policy was announced. The University of Saskatchewan has had proof of vaccination policy in effect since the start of the fall term, and it's working extremely well. Last night, they told us that 96% of their combined population of students, faculty, and staff have received their first shot, and 91% are fully vaccinated. That's an incredible success story, especially when you consider that most students are younger people, and younger people have had lower vaccination rates. So 91% fully vaccinated. That's a great job at the U of S. Overall in Saskatchewan, over 80% of eligible residents have now received their first shot, and 72% are fully vaccinated. Those numbers are increasing every day, but we still need to get them higher. The government and the SHA will continue to do our part by making vaccines as accessible as possible in many locations, in as many locations as possible. We're asking for you to do your part. If you have not yet got vaccinated, it's not too late. Get vaccinated as soon as possible. Our government is taking additional steps to help screen and prevent COVID-19 infections across our province. We are expanding capacity for public distribution of rapid tests to help identify COVID-19 cases and reduce pressure on the provincial laboratory. We continue to receive rapid tests from the federal government and have requested an additional 1 million tests, which will arrive in mid-October. Rapid tests will soon be available for the general public, with tests available in communities across our province. In Saskatchewan, the Public Safety Agency bases, municipal and First Nation fire halls, and selected SHA locations. Of course, we continue to offer rapid tests to schools across the province, and we will be providing them an additional 475,000 tests. These tests will be targeted at households with students under the age of 12 to help protect those who are ineligible for vaccination. With the expansion of rapid tests and asymptomatic surveillance, public testing sites will shift from symptomatic testing only, with a few exceptions, including those that are in close contact of a COVID-19 infection, persons identified in an outbreak situation, and confirmation of a positive rapid test. By preserving laboratory testing and symptomatic and confirmatory COVID-19 testing only, we can ensure timely results for those who need it the most. In order to better protect against extremely vulnerable populations, our government is expanding the COVID-19 booster program. Effective October 4th, this will include residents 80 years and older with at least 6 months following their second shot, and other immune-compromised and clinically extremely vulnerable individuals, including those with autoimmune diseases and those who have received chemotherapy or radiation therapy in the last 6 months. Eligible recipients are encouraged to visit pharmacy and pop-up clinics listed on the SHA website to get your booster shot. Over the past number of weeks, we have released daily data that clearly demonstrates the wave is beginning is being driven primarily by unvaccinated people. New cases are overwhelmingly unvaccinated people. Hospitalization and ICU admissions are overwhelming unvaccinated people. And sadly, deaths are overwhelming unvaccinated people. The vast majority of Saskatchewan people that have done the right thing, and to those people I say, thank you. Thank you for protecting yourself, people around you, and our healthcare system. Thank you in advance to those who make the right choice to get vaccinated in the coming days. And to those who choose to remain unvaccinated, you are prolonging this pandemic. You're making things very difficult for the rest of us and our healthcare system. You are putting yourself and others at risk. I truly hope you will think about that and get vaccinated as soon as possible. Thank you. I'll turn it over to Dr. Shahab.
Thank you, Minister. Good afternoon, everyone. So I'll maybe just pick off from some of the comments Minister made, and just reiterate that we are in a very challenging situation right now as we look forwards to the fall. We have 81% first dose uptake, 72% second dose uptake. Uptake is increasing by 1% in each of those two categories per week, which is great. But we do need to increase our vaccination rate, because even with these high coverage rates, because we have almost exclusively transmission of the Delta variant, we are also at the same time seeing the highest case counts that we've ever seen, and resulting in the highest hospitalizations that we've ever seen. And this is, a pandemic of the unvaccinated. It is burning through networks of friends, families who are primarily unvaccinated, and spilling over into schools as well, primarily from households that have unvaccinated members in households. We are, obviously schools are doing a great job of keeping students safe. And while students who are close contacts in the school setting can continue to attend school, we are looking at other aspects of the public health order, because exposures in the home or other settings sometimes do result in increased importations to schools. So even though schools are not the source of transmission, schools are reflecting the high community transmission, which, as I said before, is primarily in the unvaccinated, which is mostly, working age adults, but also then household members who are too young to be vaccinated, including children under 11. And our daily case numbers show that up to a third of cases are in school-age children now. As the minister said, COVID-19 is now really finding out pockets of under-vaccinated populations, whether they're geographical or through networks of friends and family, and is, exerting a heavy toll. If any of us thinks that we can escape COVID because everyone else around us is vaccinated, that's not true. We will all get COVID. If you're vaccinated, we won't get symptoms, or will likely get mild symptoms. If you're unvaccinated, the reality is that, you have a high risk of hospitalization. And if you're in hospital, you have a high risk of ending up in the ICU. Up to 5% of all people who get COVID end up in hospital, and 1 in 5 of those in hospital end up in the ICU. And, while healthcare providers are taking heroic measures to meet the needs of increasing hospitalizations, the trend is such that not only is it impacting non-COVID care, even non-COVID essential care, it is a very tragic and preventable hospitalization that increasingly is impacting young populations. A significant number, up to 40% of our hospitalizations are in people under 50. It is increasingly impacting parents with young children, resulting in long-term hospitalization and even, unfortunately, in some cases, death. So I think it is essential now that we address all the reasons we have chosen not to remain, not to get vaccinated, and make the right decision to get vaccinated. And I'll quickly mention, the 5 C's: convenience, lots of opportunities to get vaccinated; complacency, we have no time for complacency; If you have any questions, go to trusted websites, talk to your trusted healthcare provider, your pharmacist, your family physician. There are hardly any contraindications to get vaccinated. You've had an anaphylactic reaction in the past, or any other reaction where your a public health or medical health officer has reviewed and not recommended further vaccines, that's the only contraindication. And out of the hundreds of thousands of vaccines given, I know only of a handful of true contraindications in Saskatchewan. So do get vaccinated. If you have any questions, talk to your healthcare provider. I think everyone, I got a lot of calls when I said that why are 30% of the population mired in conspiracy theories, and several people contacted other primary care providers and said, you know what, I don't have a conspiracy theory, but I have this condition or that condition, and I think I should not get vaccinated. And that was a mistaken belief that people had in their minds. And so I would urge you to look at the information that's on credible websites, talk to your healthcare providers. There's virtually no contraindication to get vaccinated. And if you have a contraindication to one of the mRNA vaccines, you can get the viral vector AstraZeneca vaccine and vice versa. And the other thing is that, we know that vaccination rates are lower in the north, in south rural communities, and faith-based communities. These are communities who help out each other. These are communities of hardworking people who stick out for each other, who help each other during times of crisis. Many faith-based communities. And right now, I think getting vaccinated is important to protect ourselves and protect those around us, to keep our children safe in school, to keep our elderly who may have waning immunity or immune suppression safe, and to keep ourselves safe. Even if we're young, we're not immune to serious outcomes from COVID, and our friends and family members who may be young are not immune to outcomes. So I think, we have a tradition of helping each other out. And right now, the most important thing we can do is get vaccinated if we haven't taken our first dose, and complete the vaccination with our second dose, 28 days after our first dose. Now, this will take time, along with the indoor mask mandate, to bring our numbers down. We're obviously watching the trends with great concern. The cases that presented 2 weeks ago, 400, 500 cases a day, are resulting in up to 25 hospitalizations a day, 5 ICU admissions a day. The cases that present today, 400 on average, are going to continue to result in hospitalizations over the next 2 weeks, creating great pressure on hospitalizations. But actions we take today, and we know we have to wear masks indoors, we know we have to show proof of vaccination now before going to non-essential areas. But other actions that we take today can have an impact over the next 1 to 2 weeks and longer. We are entering the fall. Thanksgiving is around the corner. We need to keep our gatherings outdoors. The weather's still great. Make sure we wear a mask in indoor public places. Stay home if you're sick and get tested. Up to half of our hospitalizations, people are getting sick, they're getting worse, they're not seeking testing, they may be transmitting to friends and family members, and they're showing up in ER, going straight to ICU, and that is the first time that they're getting a COVID test. So I think we need to seek testing if you're symptomatic and stay home. That is essential. That's always been essential to address transmission, and that remains even more essential now. And similarly, I think we'll continue to have to watch all other metrics and see, are the measures that we have taken today enough? And this includes, mask use in indoor public places, includes proof of vaccination or a negative test to enter, to access non-essential areas. It includes being vaccinated or undergo testing as an employee. But if this is not enough, I think other measures will have to be considered. But again, I'll reiterate that the bulk of the transmission is happening in the small minority who remain unvaccinated, and secondary transmission is happening in persons 60 and older who may have waning immunity and are showing breakthrough cases. And we will be presenting data from September on breakthrough cases shortly as well over the next few days. Thank you.
Thank you, Dr. Shahab and Minister Merriman. Just a reminder, if you want to ask a question, to use the raise your hand feature. And we're going to start with Murray Mandryk. If you want to unmute yourself, go ahead, Murray.
I'm sorry, I can't hear you, Murray.
It looks like Murray dropped, so we'll...
Okay, how's that? We'll try it. Oh, no. Okay,
Sorry.
there he is. How you guys doing?
We got you, Murray.
There you go, thanks. My apologies. A lot of the things that you outlined today did not happen by happenstance. This is a direct result of what the government has or hasn't done over the last few months. I did not hear you take responsibility for that in your opening statement. I do not understand why, with the public demand out there, that you are not expressing an apology for missteps, misjudgments, and being absent on this issue. So my first question, I'll only ask two, is that can you tell us why you haven't apologized or why you are not apologizing for the government's actions and the situation we're now in? And will you take the opportunity to do so now?
Thanks for the question, Murray. And I take everything as Minister of Health as my responsibility, and ultimately it does land on my desk. So I absolutely do take responsibility for everything, the good, the bad, and everything in between that happens within the healthcare system. As far as what we have done in the past, what we have always done is we make decisions at points in time. When we made the decision of coming off of the public health measures back in June, our rates were coming down, and we had that July 11th target date of 70%. We hit that target date and we started to move away from all of our public health restrictions. Then, as the numbers started increasing, there were other public health restrictions that we allowed the schools to be able to move to different areas depending on what their COVID outbreaks were in their specific schools. And now we've come in with a host of measures to be able to make sure that we're trying to control the numbers. We started with the allocation of the emergency order, reinstituting that, which wasn't taken lightly. That we brought in so we could move our healthcare workers around to address this insurge that we were seeing in the health care system. But we've also implemented massive health restrictions in the last little while. And we're continuing to do that, Murray, based on the information that we have on hand.
I don't understand, sir, how that takes into account or the missteps of government. Do you recognize that you've made several missteps as government? And moving this forward, many people, obviously the opposition, have asked for your resignation in this regard. I get that happens in politics a lot, but it's actually being asked by other people that aren't in politics simply because they do not see you and your government having taken responsibility for your absence in the last few months, for the missteps and misjudgments on the severity of the fourth wave. Did you consider resigning? And once again, I am a little unclear as to whether you were actually apologizing or not, because I didn't actually hear the words. And I'll bow out.
Well, thanks, Murray. And again, I've taken all of my responsibilities extremely seriously, from not being an MLA to being Minister of Social Services and now Minister of Health. There's no set playbook on this. We make the decisions we make at a specific point in time, looking at all factors out there. There's many factors that are out there. There's modeling information, there's case counts, there's positivity rates, there's hospitalizations, there's ICUs. There are many things that we take into account when we make those decisions at a point in time. But I do, and I certainly want to convey that I take everything very serious. There hasn't been a day this year where I haven't been in contact with my officials, with my chief of staff, with people within the healthcare system. I have yet to take a day off to be able to manage this unprecedented time that we're in the best we can possibly. So I do appreciate the question, Murray, but I do take everything that I do in the past and in the future extremely seriously.
Next, we'll go to Phil Tank with the Star Phoenix. Phil, go ahead and unmute yourself.
Yes, can you hear me? Thanks.
You
Thanks
bet,
for
go
taking
ahead.
my questions. I'd like to ask, Dr. Shahab mentioned that they're looking at the public health order. Why are you not implementing more measures today? And I'll also ask, what is the possibility of success of requests like that from the city of Saskatoon, the SMA, the nurses union, especially in light of the fact that, you, Mr. Merriman, said this summer that, public health officers can make requests for more restrictions, and the public health officers of the northern half of the province did make that request of you, and nothing happened, and that continues to be Canada's worst COVID-19 outbreak by a large margin.
So maybe I could speak earlier, and that is correct. I have been in contact with medical health officer colleagues throughout, the summer and now August and September. And of course, many of the recommendations that were made generally have been put in place in terms of mandatory isolation required for cases and contacts. There's a mandatory mask order in place. We do know from the information we have that 50% of transmissions happen in households, and if households are crowded, and transmission is more hard to prevent, and with the Delta variant, it's more hard to prevent. Obviously, that's a challenge for crowded household settings, both in the north, but also urban core areas as well. We also know that up to 20% of transmission actually happens in small gatherings in people's homes. So that's why I have been reiterating that keep your gatherings small, keep them outside. Many people who are fully vaccinated are doing the right thing and going back to their 2 or 3 household bubbles. If you're unvaccinated, you are creating a risk for everyone, vaccinated and unvaccinated, if you are going to a birthday party or to any event. And it's unfortunate to say that, but I think if this is the time now where if you're unvaccinated, you need to stop attending, going to other people's houses indoors till you get fully vaccinated. And for non-essential public spaces now, you cannot access till you're vaccinated or have a negative test. But and there may be a need for an order for private gatherings. I know that's been a demand from the north, but at the end of the day, enforcement, other challenges remain. But I think we all need to think, how we are placing others at risk by remaining unvaccinated and exposing others in those small, indoor gatherings that will become more frequently. And I said before that we are looking to a very challenging fall, actually. Thanksgiving's around the corner. Many people who are already very safe are making themselves even safer by limiting their interactions in their homes to other vaccinated groups and families. And maybe they will even seek testing just to make sure that they meet together each other safely. But I think, for those who remain unvaccinated, it's going to be a challenge. And the solution is easy, actually. It's 2, jabs, and that's it. And, I think with such an easy solution, if things don't change, unfortunately, maybe other public health orders may be required, but the pressures on the acute care system will continue to increase.
So my question was actually, why you're not imposing more restrictions right now, and what the success of requests like that from the Saskatchewan City Council will be. And my second question is, do you consider this a crisis right now? Like, do you, and if it's not a crisis at this stage, given how many people we have in hospital and ICU and our case numbers, what would constitute a crisis? So I'd like to hear from both Dr. Shahab and the Minister on that.
Sure. Maybe I can start with that. It's an extremely challenging situation. We've never seen this before. The word crisis can mean different things to different people, but it's certainly an extremely challenging time. I'm hearing this directly from the doctors, sometimes indirectly from the doctors. But just going back to your previous question about in the north, I had the opportunity to meet with the Federal Minister Haidu last week to be able to discuss some strategies in the north, something that worked in other provinces that she might be aware of. I've talked to my counterparts in Manitoba and Alberta to see if there's any implementation strategies that work to be able to increase that, whether it's in the remote community or if it's on or off reserve or if it's in rural Saskatchewan, if there's some ways out there that we can certainly increase the vaccination rate, we're looking at that. We're calling on our provincial and territorial counterparts to see if they can assist us or if they can give us any great ideas on how to implement better strategies in the north. And just referring to Saskatoon City Council, it's something that just came up today. We haven't had full time to be able to review that, but we certainly will review that and get an answer back to the City Council. But I applaud the City Council for being proactive and looking out for their community, and we'll consider that recommendation when it's officially brought forward to us.
And next we'll go to Arthur White-Crummy.
Yes, thanks so much for the time and for taking the question. I just wanted to ask the minister, you've been somewhat hard to reach over recent weeks. We've been getting mainly statements and not interviews, and of course you haven't appeared for one of these press conferences in, I believe, over a month now. And I'm just wondering where you've been, why that is that you haven't been particularly visible to the public when that's part of your job as a government minister.
Absolutely, Arthur. A great question. I have been available to the media in the past more often. I think I was out about a month ago. Premier has been out a couple of times since then, and as Premier always has a prerogative of going out, but that doesn't mean that when the Premier goes out that I'm not sitting in the next room talking to him about what's going on within the healthcare system, and I'm always available to be able to come out and meet with the media, and I will make sure that I make myself more available. I have been in Saskatoon or in Regina. I can tell you, my wife can attest to this, that I've been down in Regina more than I've been in Saskatoon lately, but there's other things that I'm working on. We obviously have a huge issue within our COVID within our healthcare system, but there are also other healthcare issues that I'm working on with other provinces, like the Trikafta announcement just the other day, working with our federal counterparts, working with stakeholders like the Hospital Foundation. There are a ton of meetings that I am taking, trying also to maintain the other side of our healthcare system, the non-COVID side of our healthcare system, while doing everything we possibly can, working with my officials, the SHA, and all of the frontline workers to be able to manage the current situation that we're in with COVID. So I have been available working out of my office in Saskatoon and Regina, and I will make myself more available in the future to the media, absolutely.
Thank you for that. And I have one more follow-up kind of to a previous question that came out of Murray about taking responsibility. I did, of course, hear you broadly take responsibility for your file, which kind of goes without saying. But I'm wondering, in late August, you sort of dismissed the idea of further restrictions. You maintained that bringing in a proof of vaccination system might infringe on people's rights. And of course, those are in place now, but several weeks later than they could have been. And we now find ourselves in a situation where we have about 300 people who are in hospital beds, where the SHA is concerned that we might be getting to a point where we have to triage people. And I'm wondering whether you take responsibility specifically for that delay and for the situation that has resulted from it.
Certainly, when I spoke to the media in late August, was not my intent to be dismissive of anything. What I said at that point in time, when we were looking at the numbers, there was no change in direction at that specific point in time. Now, since the Delta variant has moved very quickly through our unvaccinated population, we've had to make some changes, and we've had to make those changes very quickly. I do assume responsibility for everything that happens in the healthcare system and everything that is COVID related. At the end of the day, it stops on my desk, so I do assume full responsibility for that. And I want to make sure that I convey to the people out there that I do take this extremely seriously. I take this extremely seriously. This is something that all of our government has taken serious, our MLAs, and I know that it is first and foremost on people's mind, and believe me, it's the first thing that I wake up to in the morning and the last thing I think about before I go to bed. If I happen to sleep that night, but I do take this seriously. Everything that happens in the healthcare system is my responsibility.
And next we'll go to Mickey DeJuric with the Canadian Press.
This is toward the minister. You have requested monoclonal antibody treatments and tests from the federal government. This is something that we've received before from the Fed. So I'm just trying to understand, what are the specific goals and outcomes based on your current request, and why do you think this will be different opposed to the previous supply we got?
Sure. The previous supply that we have was used in very limited circumstances. This is another tool that we can use to be able to help potentially prevent hospitalizations or certainly severe outcomes. It's something that we've requested of the government that they could send us, certainly Alberta and Saskatchewan. I just talked to the Alberta minister not too long ago about how we can partner with this. And if this helps us get 10 to 20 people out of our hospitalization system and a few out of the ICU, it's certainly worth the investment. But it's a host of things that the Premier is working on with the Prime Minister to be able to meet our needs here in Saskatchewan.
Thank you. And then my follow-up question is for Dr. Shahab. We live in a civilized society. We live in the Western world. We have Western medicine. We are citizens of a G7 nation. Yet people in this province are on the verge of not being able to access basic health care. Does that weigh heavy on you? And how do you deal with the reality that we're facing, where we are starting to triage people in the form of canceling surgeries, and we might be soon facing more triaging in the weeks to come?
Yeah, absolutely. I think I'll maybe preface that by saying that, I have colleagues around the world and where healthcare workers are waiting in line to get vaccinated, elderly are waiting in line to get vaccinated. 40% of the world has been vaccinated, primarily in G30 countries. Many parts of the world have vaccination rates as under 5%. So this is the world we live in. And these are parts of the world with poor access to primary care, or let alone secondary or tertiary care. So yes, I agree that we are in this strange predicament that we have had enough vaccines to vaccinate everyone in Saskatchewan, not 70%, not 85%, 99%. We have had enough vaccines to vaccinate everyone by July, August, and we are only slowly inching up now, 72%, 73% 2 dose, 81% 1 dose. And also we have seen how vicious Delta is, that even with a third of the population not fully vaccinated, it is creating enough hospitalizations to stress the health system, which is leading to your other comment, which I totally agree that, I think we all want to healthcare providers never want to say that they're unable to care for everyone, but the reality is that not only elective surgeries, but urgent surgeries, and Derek could speak more to that, but urgent surgeries are being delayed, aren't able to happen, and that's very tragic. We've got $1 billion healthcare system, one of the best healthcare systems in the world, that is not able to do what it's designed to do because it's dealing with a totally preventable, vaccine preventable problem. And I think that is a tragedy for all of us. And I think we all have a role to play in addressing this. But again, I think as friends, family, we all need to reach out to our family members also to understand why they're still hesitating. I know all of us have been doing that the last few weeks, but I'll maybe just stop there. But I totally agree that it is a tragedy of our times that being in a very privileged society, we are facing this dilemma.
And if I could just add to that, the healthcare system is still intact. I want to make sure that we emphasize that. If there is somebody out there that needs medical attention, they should seek it immediately. The frontline healthcare workers doing an amazing job of being able to navigate in an extremely challenging time. This isn't an ideal situation we're in. This is not something that anybody wanted in our healthcare system. It's something that we have to deal with right now. And the healthcare workers will be able to make those decisions on what the triage is, if there is any of that required. But if you do need health care, please seek it out, and we will manage the best we can. I know the frontline healthcare workers, the doctors and the nurses and all of those within our system will make sure that you get the best treatment as possible.
And next we'll go to Alison Bamford with CTV.
Hi, can you hear me?
Yep, go ahead.
So the Saskatchewan Union of Nurses is saying we're in a human health resource crisis. The SHA said today it's having to close some rural ERs, yet Minister, you rejected federal assistance in the form of human health resources from the federal government. So why did you reject that assistance that healthcare workers have been asking for? And what is the threshold for you to then go back to the federal government and ask for that?
Well, we haven't rejected any assistance from the federal government. We have asked the federal government to help us with the antibodies. We've asked the federal government to help us out with testing, and we're doing that. And we've certainly asked the federal government to help us within our Indigenous community on and off reserve. So we have been working with the federal government. Like I said, I was meeting with the federal minister probably every 2 to 3 weeks by phone prior to the election, and was very appreciative that she set some time aside for me right after the election to do a check-in. And I mentioned to her at that time, and I've sent her a letter saying, thank you for the offer, appreciate that. If we need to reach out, we will. We feel that we can manage things right now. But if that opportunity does present itself that we need to reach out in a different way than we've already reached out to the federal government, then we'll consider that at that time.
Why do you think postponing non-elective surgeries, having to close rural ERs, moving people around the province is managing this crisis that healthcare workers are saying it is, rather than being proactive and asking for bodies to come to Saskatchewan and help out the people who are already burnt out?
Well, I would say we are being proactive. As Dr. Shahab laid out, as I've laid out, as the Premier have laid out, the best way to battle this issue is through vaccinations. That's why we have had our vaccination clinics all throughout the province. We've had them in pharmacies, we've had them at drive-through locations, we've had pop-up clinics at festivals, at football games. The best way to deal with this and get us, if we had 200,000 people that went and got vaccinated in the next 28 days, that would have the biggest impact on our healthcare system versus anything else. So that's where we're focusing, but we're also complementing that with some public health restrictions to be able to make sure that we're flattening out this curve as much as possible. And as you can see, our numbers have stabilized at a very high rate, but they have stabilized. So we're hoping that this combination of a vaccine push, the restrictions on people that are unvaccinated, and also our other healthcare measures will bring those numbers down. But again, I can't emphasize this enough that the people that we're seeing within our testing facility that are testing positive, also in our hospitals and our ICU, these are the majority of them, as I identified in my opening comments, are unvaccinated individuals. So the best way to be able to make sure that you don't end up in our healthcare system or you don't end up COVID positive is to go out and get vaccinated. Derek, did you have anything that you wanted to touch on that?
I would agree 100%, Minister. That is the path out of this. Just touching briefly, you commented on the pressures that we're experiencing in the health system, and certainly I wouldn't underplay any of that. We're currently sitting in a position where 85% of our normal ICU capacity is consumed by COVID cases, and we are seeing the numbers continue to increase. While we do have plans to surge and create additional capacity, it does come at a significant cost. We have redeployed healthcare workers. We have changed some staff to patient ratios in some places in order to support redeployment and care for those COVID patients. And this creates a lot of stress on individuals who are already tired. They've already been caring for COVID patients through the course of the pandemic, and are under a lot of stress and fatigue and uncertainty about what might come in the future. And then in order to do this, we also have this significant slowdowns that have happened across the province that are certainly impacting others. I will also emphasize the point the minister made, is that we are sustaining all emergency services. And so if you require urgent care, then please don't hesitate to seek that out at your closest hospital facility. Ultimately, this is a single preventable disease, as Dr. Shahab has mentioned a number of times. Our path out of this remains high levels of vaccination. So please go out and protect yourself and your loved ones. And not only against COVID, but help us get the health system back so that it is fully functioning the way that that you expect it to.
And next, we'll take a question from Emily Olson with Global.
Hi, thank you so much. Can you hear me?
You bet. Go ahead.
Wonderful. Thank you so much. Dr. Shahab, you used the word tragic when discussing the state of hospitals and healthcare current in the province. And I mean, that is an accurate description. We talk with healthcare workers all the time who are on the verge of tears, discussing the things that they're witnessing, talking about the level of work that they have right now. I mean, it's no secret how challenging things are. Obviously, the weight of getting out of is on the unvaccinated. However, of course, it is a slow process. And it seems to be currently in your hands to implement restrictions not only healthcare workers are begging for on a weekly, if not daily basis, also your own data would suggest is critical. So if 1/3 of school-aged children are in those are what the cases are currently, why are there no restrictions currently, or better case tracking or more isolation for kids right now? If 20% of the cases we're seeing are from small gatherings in homes, why are we not implementing gathering restrictions for people who are unvaccinated, or just in general for a temporary time until things get under control? I'm just curious, when the data is presented here so clearly, why there aren't specific things coming into play, especially when healthcare workers and a number of parties are desperately asking for these things to come into place.
Yeah, thank you. So I'll maybe address some of these. There was a lot in that question. I think I absolutely would recommend that we all need to be very cautious with indoor private gatherings, small indoor private gatherings. I've already said that people who are fully vaccinated, many of them are making adjustments. And, my recommendation is that if you're unvaccinated, you don't go to any gathering till you get fully vaccinated. Should that be part of an order? Certainly, I think that needs to be seriously considered. It's been a long-standing request from northern and far north Saskatchewan. But as an order, then it has also to be enforced. But certainly that would address possibly 20% of transmissions, and especially as if we see that the mask mandate and other measures may stabilize the curve, but it will take a long time to come down. We will not only not have Thanksgiving at this rate, we will likely not have Christmas and New Year at this rate. It will be a fall and winter of misery at the current rate, that we will have higher hospitalizations due to preventable illness. So absolutely, those other restrictions will likely have to come if our numbers don't change. But again, in terms of how restrictions are implemented in North America and in Western Europe, Western liberal democracies, ultimately the government decides what legislative tools it imposes on citizens. And there's a comment made about highly developed societies, which we claim to be, but where citizens also not only have rights but they have responsibilities. In other parts of the world, SIM cards have been cancelled till you get a vaccine. There's mandatory tracking apps. As long as you have a phone, you are tracked all the time, and you get pinged if you are a close contact, and then you are tracked to make sure you don't leave your house. So there are tools that many other parts of the world have deployed. We claim that we don't need those tools because we as citizens have not only rights but responsibilities. So I guess it's on both government and citizens of that country and province to demonstrate that. And I'll leave it at that.
Thanks, Dr. Shahab. I guess from my perspective, everybody has to do a personal risk assessment. If you're vaccinated, you have to do a personal risk assessment of where you're going and what you're, who you're interacting with. And if you're unvaccinated or if your child is not able to get vaccinated, you also have to make that personal risk assessment. But the best way, if we're seeing a majority of cases of children coming out that are testing positive from unvaccinated homes, we need those parents to get vaccinated to help control the spread of COVID-19, certainly in their home and maybe to their neighbors and to their community. So I would encourage people to do your own personal risk assessment. Dr. Shahab has been saying this for months now. Make sure that you do your personal risk assessment and look at the circumstances that you're in and where you're going, and then decide whether it is best for you to be able to attend that event or go over to that person's house. And if not, then just maybe give them a phone call and stay away if that's what you're feeling. But you have to do your own personal risk assessment on this. There's not going to be one thing that's going to cover everybody.
Emily, do you have a follow-up question?
Yes, I was actually hoping to touch on the organ donation program closure and how that's impacted families, and whether you think that was the right call and why.
I guess from my perspective, none of these are easy decisions that we're having to make, whether we're slowing down services or we're postponing surgeries or if it's the organ donor. These are all having impacts on specific people throughout the province. So the decision's not made lightly, but we need to have those expertise in our ICU because we are dealing with people that are unvaccinated. That's what it comes down to. And I know there's people who've been waiting for a long time, either for their surgery or for their organ donation or their procedure or their consultation. And those decisions are made very seriously to make sure that we're trying to protect those that are coming into the hospital versus some people that can maybe be delayed for a short amount of time. Again, this is an interim step that we're taking, but every one of these decisions is extremely serious on what we want to be able to maintain in our healthcare system. And my commitment is to make sure that we restore all of those services. We started to ramp up our surgeries in July and August to be able to catch some of that backfill. And as soon as we are past this very critical time in the fourth wave, we will start to resume those surgeries and we will start to resume the organ donation and we will start to resume the programming that have been put on pause during this very challenging time.
Okay, thank you so much.
Thanks, Emily. We'll now go to Laura Fominov with 650 CKOM.
We can't hear you, Laura.
So,
Laura,
hi there.
are you there?
Sorry, can you hear me?
Yeah,
can you hear me now?
Go ahead.
Okay, my apologies there. I guess my first question would be, if you're not accepting help from the federal government at this point in time, why not ask for help from other provinces with regards to nurses or healthcare staff? Give people, healthcare workers in this province, a break from their burnout and everything like that.
Thanks, Laura. We have reached out to the federal government. I want to make that very clear. We have reached out to the federal government on several issues, like the antibody testing, certainly within dealing with our Indigenous communities and on and off reserve, as well as our testing. We have reached out to the federal government. We've been working with the federal government since day one of this, and we continue to do that. We have talked to some of our other provincial counterparts. Obviously, Alberta's in a very challenging situation. They don't have any resources to spare, but we are touching base with some of our other provincial counterparts to see what their capacity is, if they can assist us in any way. We're not at that point right now, but we are looking out into the future to see what's available out there and where we could utilize or put some patients if we had to. But we're not at that point right now, but we're making sure that we're exploring all options. So we have reached out to the federal government and we continue to work with them, and we appreciate the support that they've been giving us.
Okay, my next question would be, the head of respirology at the University of Saskatchewan says asking people to do things has not worked, and that has been proven. And your message from the province remains the same and has for some time. The head of respirology says we need concrete public health measures, additional public health measures. So my question is, why are you offloading responsibility onto the public when you could simply implement simple public health measures like gathering limits in addition to what's already been implemented?
Well, I think we have some pretty strict health measures in place right now, and I appreciate the input. I haven't seen exactly what that individual has requested of us, but we have put in significant health measures, as well as we are putting in the QR code. We're putting in the verification of vaccine that's going in on Friday. These are all to be able to help get more people vaccinated. If we put public health measures in place, that'll slow things down temporarily, but that does not solve the problem. The problem is we need to get that 30% of people that aren't fully vaccinated yet vaccinated. That's where we solve this problem, is through the path of vaccination, not necessarily through public health. Public health measures are extremely important, but that's not going to get us to the end of this pandemic. The vaccines are.
And now we'll go to Adam Hunter with CBC.
Physicians have asked to see modeling from the SHA and government to see where this is headed. I'm wondering if, first of all, why you're not sharing it, if you could share it, and also if you're not sharing it, what is it telling you about where this is headed? I think Dr. Shahab just touched on it being a misery for the fall and winter. What can you tell us about where this is headed, as far as the SHA knows for modeling, and maybe why this isn't being publicly shared?
Yeah, as I've mentioned before, modeling is one tool that we have within our arsenal to see exactly what's coming. We have our test positivity rate, we have our case counts, we have our hospitalization, our ICUs. These are all factors that we take in. It's not just one thing of the modeling. The modeling has had struggled in the last little while of providing accurate information outgoing. Some of the modeling didn't take into account vaccination rates, didn't take into account geographics within the province. So there are some challenges with the modeling, and I'll throw this over to Derek, and he can provide some information. But we still do use the modeling, but it is one of many tools that we use to be able to decide how we impose public health measures and how we also address the vaccination problem.
Yeah, thanks, Minister. I'll say that it is a tool in the toolbox in terms of understanding what possible demand we might see in the future, and the SHA has relied on modeling information in order to project different scenarios so that we can ensure that we have proper contingency plans in place should one of those scenarios actually come to fruition. And you would have seen at different times that there has been modeling information shared from the SHA, most recently with the planned surge numbers that we're working towards to meet COVID demand going forward for the next few weeks. So there is there have been, I guess, recent sharing of that information in the context of specific steps that the SHA is taking in order to be able to respond to potential increases in demand.
Maybe I can also add to that. So, like Derek said, obviously short-term projections are critical for planning for the next 2 weeks, and that's where the short-term stresses are. And we know that, cases that present today, 5% of those will need hospitalization within the next 2 weeks, and 1% will need ICU care. And this is ongoing. Like, when I talked about a bleak fall and winter, when you plan for a mass casualty event, that happens, and then you seek assistance from other provinces and you surge up. But we are having a mass casualty event every day now for the foreseeable future. But modeling then also takes into account, and it has evolved. Like, obviously, when we had our latest third wave, mostly in Regina, we used, as the minister said, metrics as well as short-term and medium-term projections to give 3 scenarios of no action, which would have resulted in high case numbers just from Regina, which would have stressed the healthcare system, and we came close to that. Just 200,000 people living in Regina, and later on southern Saskatchewan was stressing the entire health system in Saskatchewan. At that time, our elderly were well protected in March, but not so much the working age, and that's where hospitalizations were happening. And then there were three options, minimum public health measures that were present throughout the province that would have resulted in a high surge, or a slowdown, or a total lockdown. And the final decision was we went with an option. The government went with an option in between slowdown and lockdown, where Regina went to take out only, a lot of recreational centers were closed for 6 to 8 weeks, and that brought the surge down. But at the same time, vaccination was picking up as well. And now, of course, modeling is constantly calibrating to increase vaccination rates. So the modeling was really bad 3 weeks ago with our vaccination rates at that time. 2 dose was well under 70%. The modeling now is looking slightly better with 81% 1 dose, 72% second dose, and that's where vaccination rates can have the most impact on a daily basis. As they go up, the modeling starts bending to a more favorable projection, but it's still 2 to 4 weeks out, and for vaccination it's 6 weeks out. If someone gets vaccinated 1 dose today, second dose 4 weeks from now, the modeling only inputs the benefit of that 6 weeks from now. So that's where the short-term projections, 2 weeks, long-term even 6 weeks, the vaccinations don't kick in right away. Mask use, obviously, like the minister said, we may be seeing some early indications of some plateauing, but it's going to be a long plateau with a slow fall. And then, therefore, I said, not a great Thanksgiving and not a great Christmas and New Year from what we are seeing. And then, the challenge with additional public health measures is that, broad lockdowns defer the issue to the future, and they capture everyone. But with 20% of the 30% of the population primarily transmitting for the most part, what are the tools that really address that aspect? So obviously, proof of vaccination or test is one tool, and there could be other tools such as restrictions on people who are unvaccinated going to small household gatherings or larger gatherings, in addition to potentially limiting gatherings as well. But again, I would say, there's public health orders, but then there's social pressure, and no one wants to say to a friend or family member that you're not welcome because you're not vaccinated. But I think, unfortunately, that's where we are today, right now.
And Dr. Shahab was exactly right. What happened in Regina, there was increased restrictions. But what we also did in Regina is we put in 15,000 AstraZeneca through a drive-through to be able to make sure that we had as many people vaccinated in that city as we possibly could in a short amount of time. And that had a huge impact on the outcomes in Regina and definitely shortened things. So if we had that same kind of surge across the province, we would be able to manage this very much better, and certainly in a faster way if more people were getting. If we can get 5,000 to 8,000 people done a day in the province, would be a significant impact on our hospitalization and our COVID, as Dr. Shahab said, a few weeks out from now.
As a follow-up, the province's COVID situation is by most metrics the most dire in the country, highest case rates, death rates, lowest vaccination rates still, and the government waited until about 2 weeks ago to implement measures which were called for by medical health officers a month earlier, as you'll recall. So what is the level of cases or deaths per day before the government either decides to go in with public health measures or call in the federal government or other provinces for help? I guess I'd like a number or some kind of sense of what the province is looking at, so people can expect, if we see this continue to rise and not peak, where we're going.
Yeah, and as I've said, and I mentioned in some of my other comments, we have called on the federal government. We were working with them certainly on the vaccine rollout since December of last year.
That wasn't my question, though, Minister. Sorry, I know your answer on that.
Okay, so sorry, what was the question? What was the specific question, Adam?
My specific question was, with the highest case rate, lowest vaccination rates, and the highest death rate in the country right now, what is the level of cases or deaths before the province asks for help from other jurisdictions, be it nurses, doctors, ICU specialists, or the federal government, or puts in public health measures?
As I mentioned, we have reached out to other provinces to see if they have capacity. If we get to that point where we need to call them on, we're not there right now. If we do get there in the near future, we have talked to our neighboring provinces. Certainly, as I mentioned, Alberta's not in a position to help us out right now. But the best way through this is through our vaccination process. But we have reached out to other provinces. As I mentioned, I've talked to the Minister from Ontario, Minister from Alberta, and the Minister from British Columbia on situations. I know my officials have reached out in Manitoba. Again, we have asked for federal government assistance on our testing and certainly on the antibody treatment. We have reached out for that. But right now we're in that position. Derek, did you have an additional comment?
I'll just add, Minister, we are constantly assessing our capacity requirements, and as I mentioned earlier, the impacts on our teams as we redeploy staff in order to create that capacity, and certainly working very closely with the Ministry of Health in order to identify any additional resources that might be required and at what point that might be needed in order to support our overall response.
We'll go to Dan Jones with MBC.
Yeah, just backing up there for a minute there, Matt. I think Dr. Shahab wanted to chime in on that last question.
Yeah, thanks. Obviously, whenever we do pandemic response, the ultimate goal is to protect the healthcare system. But public health always wants to be proactive, and while you can't prevent every case, and we have to remember March 2020, we were trying to prevent every case through comprehensive contact tracing of primarily only people who were bringing COVID as they were entering Canada. In November 2020, significant public health measures were trying to keep case numbers low. In March, vaccinations was showing an impact. So the metrics do evolve. And, historically, I've always said that anytime you go more than 5 cases per 100,000, you should watch closely what's happening. Anytime you test positivity goes above 5%, you have to watch closely. A test positive is over 10% now, higher in northern, far north areas. Our cases per 100,000 are very high, in the high 30s, maybe touching 40 per 100,000 for some days. But then we have to count in vaccination rates. And obviously, with all this, some countries like the UK reopened with increasing case numbers because they could manage the hospitalizations. The US, some states were able to manage with fairly limited restrictions, although the US CDC did put in a mask mandate or recommendation for states to use, as well as additional days for schools that we have. But they have 2 to 3 times the ICU capacity that Canadian jurisdictions have. And then, obviously, that's where you need to put in further measures because the healthcare system is being stressed. So I just want to emphasize that the metrics that are used are always looked at, and Mr. Merriman commented on that. But, public health desires to keep case numbers as low as possible while not unduly limiting people's ability to do things that they enjoy or other activities. But right now, I think it's a challenging situation because it is a third of the population that's using transmissions, and I think some of the public health measures have to be optimized to address that population versus the entire population. But having said that, it's lockdown of broad public health measures are blunt tools, and they then impact the entire population. And I do accept, though, that I think many people who are seeing that elective or urgent procedures are being delayed, we are getting to a point where I think unless we see an increase in vaccination rates and compliance with current public health measures that results in a significant decline in case numbers over the next 2 to 4 weeks, it is leading us to an untenable situation right now. Thanks.
And now we'll go to Dan.
All right, Mr. Merriman, last week, Mr. Moe made some comments that essentially singled out the North and First Nations for low vaccination rates, and Northern leaders have been very critical of those comments. Do you find those comments to be useful, and is there any concern that there may be increased vaccine hesitancy in First Nations and in northern communities because of Mr. Mo's comments?
What I'll say on that is that's exactly what I was talking about with the federal minister, and I asked her to touch base with Minister Miller, who's in charge of Indigenous the communities, to be able to make sure that we're doing everything we possibly can. We've had partnerships with the Saskatoon Tribal Council. That's where I got my second shot, was at the walk-in clinic at Sask Place with the Tribal Council. We've had great partnerships. There's great leadership up in the northern communities. We have some northern communities that have an extremely high vaccination rate, well into the 90s. We have some other ones, whether they're on or off reserve, that are having some challenges. And as I mentioned before, if there's, when I talk to my provincial counterparts, we make sure that if there's some idea, some innovative way that somebody else is doing something to be able to create more vaccines or get more people vaccinated, fully vaccinated up in the north, we're open to that. So we're not calling out anybody specific. We're just saying we've identified an area of the province that needs to have increased vaccination numbers, and we want to work with those communities to be able to get those numbers as high as we possibly can.
So the Minister or Dr. Shahab, what new strategies are you looking at to implement in these communities? I mean, I guess not even maybe in the north, but also all over the province that have low vaccine rates.
Yeah, so I was just gonna, sorry, go ahead, Minister. Yeah, no, I was gonna add to Minister Merriman that we have communities throughout the province actually that have low vaccination rates, and unfortunately, when there's a surge, there's maybe several dozen cases, and then a few result in hospitalizations and deaths, and then people then do come up and get vaccinated. But I think that's again tragic that we have to. So we have these surges that happen, and then vaccination happens afterwards. But I think we need to, as the minister said, we need to, celebrate the communities that have high vaccination rates, and maybe work with those success factors, and work with community leaders throughout Saskatchewan in terms of bringing up vaccination rates. And already, the SHA has addressed pockets of under-vaccination, whether it's core neighborhoods, whether it's specific demographics who, we've talked about young men who are hardworking in various trades who didn't really see that they were at high risk of COVID. And we've heard stories from clinicians about young men with small children who are seriously ill and in some cases have passed away from a preventable illness. So I think, the initial 60% of vaccines were easy. People were lined up 6 hours in drive-thrus to get vaccinated. The next 10-15%, some more, targeted outreach clinics throughout Saskatchewan. I think the next 10-15%, like, I said earlier that when I said why are 30% of people mired in conspiracy theories, many people reached out to me and other care providers saying, we don't have conspiracy theories, we have these questions, can you answer them? And 99.9% of the time, the answer was yes, you have all these underlying health conditions. None of them is a contraindication to vaccines. In fact, because of your underlying health conditions, you are at higher risk of getting seriously ill with COVID. Whether you're pregnant, whether you're immune suppressed, whether you're immune compromised, whether you have a chronic lung condition, heart condition, liver condition, none of those conditions is a contraindication to vaccination. And in fact, if you have any of those underlying risk factors, your risk of serious outcomes like hospitalization, deaths are much higher. So, addressing those issues at an individual level, clinical level, working with communities. I know public health and SHA and Indigenous and NITA teams are working with community leaders in the north to provide vaccinations in a culturally safe and appropriate manner. Similarly, I think there's been some success with faith leaders and other municipal leaders where municipalities have been very proactive in recommending measures within their own jurisdictions about mask use, but also supporting communities that may not have been so easily reached because of a variety of factors, now getting vaccinated, working with SHA and other public health teams and providers is going to be critical. So a lot of that has happened successfully throughout the summer, but I think a lot of that needs to continue to happen quickly over the next 4 to 6 weeks. And again, I think the minister mentioned that just because you live in Saskatchewan doesn't mean that you are destined to be under-vaccinated. I think I've said that ever since June. Seniors have shown the way by vaccination rates in the high 90s, high 80s, 90s. Seniors have shown the way what we can achieve. Universities hitting mid 90s and fully vaccinated have shown the way. So just because you live in Saskatchewan doesn't mean you should accept that we will be an under-vaccinated province. And if anything, we should, we were at the top in terms of first, second doses in May, June, and I think we should aspire to be at the top again.
And for the last question, we'll go to Zach Becerra with the Star Phoenix.
Thank you very much. Minister Merriman, about an hour ago at the SHA's public board meeting, SHA CEO Scott Livingston said that on our current trajectory, he believes we may be as soon as 3 weeks away from decisions about doctors having to decide who receives life-saving care in hospitals and on asking outside jurisdictions for help. Is that the timeline that you're working with? And do you agree with Mr. Livingston's assessment, which was that very little could be done to avoid this reality?
Thanks for the question, Zach. What we're looking at is what we're dealing with on a day-to-day basis. The public health measures that we put in, the resources that we've allocated, again, through the emergency order to be able to meet of the people that are coming into our healthcare system, that combined with our increased number of vaccination rates is going to hopefully change that trajectory. But this is in the people that are unvaccinated right now. This is in their hands on the trajectory that's going to be over the next 4 to 5 weeks and the next 4 to 5 months. This is in their hands on whether they want to get vaccinated or not. Because if they choose not to get vaccinated, they continue down that path, these are going to be challenging times. And as I've mentioned, we have reached out to other provinces to see if there are options out there. And if we have to get to that point, then we'll certainly look at it. But I'm hopeful and optimistic that the people that are unvaccinated right now are not fully vaccinated will step up and change the trajectory on this as soon as possible.
If I can ask a follow-up then, unless Dr. Shahab wants to chime in.
I'm sorry, I think what I heard was the 3-week projection. So absolutely, further to what the minister said, our course for the next 2 to 3 weeks is set by case numbers reported today. And then, people who've been exposed over the last 2 or 3 days are going to present with COVID over the next 2 or 3 days. And so the most important thing for all of us is monitor our symptoms. At the first sign of symptoms, stay home from work or school, get tested, and let your close contacts know and comply with public health for all other measures. And then, mask use, cautions around indoor gatherings in the home. We know the drill. We've known that for the last 18 months. In March 2020, we could gather in groups up to 10. But no one was even doing that across households because there was so much fear. I think November, there was good compliance, but some lack of compliance in some sectors. March, again, we saw alpha variant ripping through working age adults' exposures in the workplace with hospitalizations and deaths, and then there was high compliance with measures. Now, I think there was a bit of complacency over the summer. We were doing well, low case numbers, we were outdoors. But now that fall is coming, I think there's some public health measures that are forcing us to comply with being safe. Mask use in indoor public places, proof of vaccination or negative test for non-essential areas. Many employers now requiring vaccination or a negative test that you have to pay for yourself. And hopefully other employers will, have similar practices. And in fact, workplaces should celebrate the fact that they have a safe workplace in terms of highly vaccinated staff, and so so I think in that context, while the question was the crisis that's going to unfold over the next 3 weeks, but beyond that, we also need to look ahead, and I think the way to prevent that is, as the minister said, vaccinations and cautions around indoor gatherings, even in our homes. Thanks.
as a follow-up, Minister, you say this is in the hands of the unvaccinated right now. Just over a month ago, at another press conference, you said government wouldn't introduce things like proof of vaccination requirements or vaccine mandates because you believe this would infringe on people's rights. You framed it as a civil rights issue, essentially. Governments, of course, reversed course on both those things since then. But I wonder, if you really think this is in the hands of the unvaccinated, do you regret your earlier rhetoric and your earlier positioning and framing of that issue? Was it a mistake to make this out as a civil rights issue instead of, for example, an obligation to the general public and the public good?
I think we made that decision at that point in time of where we were and what we saw coming on the horizon. There was a different time then. We didn't have.
Well, was it a mistake? I know it was a different time. I know obviously you have more information than you had back then, but was
we have to make that decision at that specific point in time on what we're doing in the near future and what we're doing further out. Our natural default isn't to impose the most strict restriction or the most strict restrictions as we possibly can immediately. We always have been, right from the beginning, this extremely surgical in our decision making and very focused on specific areas, just as we had talked about before in Regina when there were some challenges there in the spring. We were very surgical about that. So when I said that, no, we weren't looking at it at that point in time. We were not looking at verification of vaccination in businesses or within government. But obviously, there's been a lot that has changed between that point and this point in time. That's why we have changed our course. We've changed our course accordingly to make sure that we're addressing this in the best possible way that we can.
But with the gift of hindsight, do you regret it?
Well, there's lots of things you can look back, but again, there's no clear roadmap. We have to make a decision at a specific point in time with the data that we have in front of us and that we have with our test positivity rate, with our cases, as I've identified before. We have to look at all of that data. There is no looking forward into the future with a crystal ball. We have to make sure that we make that decision with the information and the statistical information that were provided by our healthcare providers, and through modeling, through other aspects that I've just identified. We're always doing that on a daily basis. We're making those decisions.
Thank you, everyone. That concludes today's availability.